Good afternoon, friends. Welcome again for the first CCI Cebu Cancer Institute webinar series, Multidisciplinary Care, a Treatment Continuum. For the past few weeks, we were fortunate to have esteemed speakers from Singapore, and now we are also fortunate to have an equally competent and esteemed speaker from the United States of America, USA. She The topic for today is uncertainty upon uncertainty, psychosocial support for cancer and COVID-19 healthcare providers. To introduce our speaker, may I introduce to you our moderator for today. She is no less than our medical oncologist of the Cebu Cancer Institute, Dr. Gemela Ann Sanchez.
Good afternoon, friends, colleagues, and my classmates from CCMC College of Nursing, and to our dear patients, this is for you. Thank you for being with us today. I'm so excited to be your moderator this afternoon. I'd like to welcome you to the fourth episode of the first PSH Cebu Cancer Institute webinar series in multidisciplinary care of cancer. There will be a lot of opportunities to ask questions later at the end of the talk. Please do not hesitate to type your questions at the chat box. I am pleased to introduce our speaker today. Dr. Rigel Alforcatan is an advanced practice nurse, and his specialty is mental health and psychiatry. Dr. Tan was my schoolmate in the College of Nursing. We both went and completed our BSN at the Cebu State College, Cebu City Medical Center College of Nursing. He has 2 Masters of Science in Nursing, one in Mental Health and Psychiatric Nursing, which was completed at the CSC, now CNU, and another master's degree in Advanced Adult and Geriatric Nurse Practitioner at the University of Alabama in Birmingham. He completed his Doctor of Nursing in Education and Leadership at the Rocky Mountain University of Health Professions in Provo, Utah. At present, he is an assistant professor at the University of Nevada in Las Vegas, where he is based. Dr. Rigel Tan has received numerous awards and has held so many prestigious positions in the US and even globally. Allow me to mention a few. He is the first Asian and the first Filipino elected as president of the Nevada State Board of Nursing. I'm very proud to say that. First native Cebuano nurse to be inducted Fellow of American Academy of Nurses. And he is also the only Filipino who became a member of the NCLEX exam committee of the National Council of State Boards of Nursing. In 2019, he was awarded one of the outstanding Filipinos in America in New York. And he also received one of the outstanding Filipino teachers in the US. Garbo gika sa subur, Dr. Tan. So today, he will be sharing with us his expertise on the psychosocial support for cancer patients and healthcare providers in these times of the pandemic. With that, I ask you to give your full attention to Dr. Tan and help me in welcoming him. Dr. Tan, thank you for kindly accepting our invitation despite your very busy schedule. I know it's midnight there in Las Vegas now. Mayong gabi diha.
Good afternoon, everyone. And this is Dr. Rigel Tan from Las Vegas. Thank you so much for the invite, Dr. Gemela Sanchez, for allowing me to share some of my thoughts, especially in this very dear to me topic, and it's about mental health. Also, I would try to create a presentation where it would be more meaningful to some of the providers, especially in this time of the pandemic. So I kind of like the title that we came up with, or Dr. Sanchez came up with, which is Uncertainty Upon Uncertainty, a Psychological Support for Cancer Patients During COVID-19. And this is all about also emotional resiliency and mental wellness during the global pandemic. So once again, I'm Dr. Rijal Tan. I'm an advanced nurse practitioner in the state of Nevada. So thank you for joining. But before I'm going to start, I would like to greet some healthcare workers, especially nurses, for this is the year 2020, who happens to be the pandemic year, is the year of the nurse and midwife. So to all nurses joining us today, my greetings for this year dedicated to your heroism. Also, I'd like to dedicate this presentation to many of our cancer patients, especially October is the Breast Cancer Awareness Month.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Kanina dalawang pila. Ito na pinakahuling ticket na release namin. Wala na po, 520. Ano po, sabi ko po, sorry, but we cannot allow any more tickets. Community quarantine is hereby imposed in the entire of Metro Manila. Clinical problems nila, kailangan na provided. Lumaban ka, ma. Malaban ka, please. Lumabang ka, ma. Lumabang ka, ma. Have therefore made the assessment.
Yes, it was indeed a pandemic. We wake up one day in mid-March of this year having to heard that the whole country, if not in the international community, is experiencing a pandemic. It was indeed a shock to some of our people and citizens. They never experience what pandemics is like. So then we start learning about it. But as we learn about it, everyone is trying to do their best. They were trying to do the job that they used to do, their roles that they used to do, in spite of the pandemic. And slowly we start to understand what the virus is all about. That it's all about how it's also transmitted and starting to affect each one. It's starting to affect the citizens of the world. It's starting to affect different jobs, and not excuse are the frontliners, the medical providers. So as we take care of the patient, we were also at risk. In fact, as of this presentation, the world has about 38 million of corona cases, with about more than 1 million of deaths. But there are more also who's recovered. In the Philippines alone, we were, as of yesterday, the 18th leading cases for coronavirus, about 346,000 cases with 6,000 deaths. And it affected everyone's life. As it affects everyone's lives, routine, it also, the question is, how is it affecting our own mental health? And that's what we're going to be our topic today. I'm going to be presenting about how this pandemic affected us, how can we show resiliency, and how do we as healthcare workers also consider our vulnerable population, especially those stricken with cancer. So to give you a background also, according to the World Health Organization, about 23,000 healthcare workers has been infected in about 50 countries. 80% of them experience mild to moderate symptoms. About 15% requires hospitalization, and 5% actually required critically ill. So what is the temperament of mental health also in the Philippines? As we deal with the new news of having a pandemic about 6-7 months ago, what is the nature of mental health in the Philippines? Well, according to World Health Organization, the Philippines has the highest incidences of depression in Southeast Asia. And that's without the pandemic still. But then facing the pandemic, you could just be concerned about, what's the statistics going to be like? About 4.5 million cases were reported in the country early 2000. But what's sad is that in the Philippines, reporting, especially in mental health, is not so much updated. There's a lag of time about cases being reported, and probably it's because of culture or social stigma. But the latest statistics we have is that in the Philippines is one of the highest incidences of depression in Southeast Asia. And 1/3 of this affected by mental health problem seeks help, but another 1/3 suffered the symptoms, but so ashamed to open up because of stigma, and another 1/3 who suffered the symptoms, but they do not know what's wrong with them. That is the challenge we have. Then we're faced with pandemic. Well, what's good to know, but it's still in a working progress, is that the Philippines in 2016 already passed the Republic Act 110136, which is actually the Philippine mental health law. And I'm glad to share with you that how it started. Actually, I contributed a little of this because what it started in 2016 is in my city, in Cebu. I have a conference and we talk about this in the city government of Cebu about needing to have a mental health law to take care of the scourging mental health reality in our country or in the city at the time. So I was able to finally get a sponsor and to make a city ordinance. It's starting as a city ordinance. So in 2016, the city of Cebu becomes the first city that actually approved a mental health law as a city ordinance approved by the city mayor. From that, the following year, Senator Ontiveros adapted what was learned and created in Cebu and initiated the Philippine mental health law. So that's what some of my contribution in the city ordinance that later become, and I was adapted to become the Philippine mental health law. This is good, because we have a highest incidences of depression. But the question is, now that we are facing this pandemic, how are Filipinos dealing with it? And most especially, how's our vulnerable population, the cancer patients we have, how they are attracting? That would be the focus of our discussion. But in a little background, as the pandemic affects the population, it also didn't spare the medical provider. In fact, the International Council of Nurses identify or believes that there's a really scourging number that is still not reported that has been affected over the past 7 months. About 600 in the US died in COVID. And what's sad is that talking about the healthcare worker here in the US is that out of 2.5 million registered nurses, I'm talking about the registered nurse, being the president of the Nevada State Board of Nursing or previous president of the Nevada State Board of Nursing, out of 2.5 million registered nurses in the US, 4% of those are Filipinos. But of the mortality, 31.4% died of COVID are Filipinos. So that's how it affected. For sure, it has also affected there in the Philippines, and the fear also is really true. So it was expected also not only for nurses, about 450,000 healthcare workers are or have been infected as an estimated by the International Council for Nurses. The general population, not only the healthcare worker, also felt here in the US how it affected them. More than half of those in the US population, I mean the citizens who lost job or has been affected in their income, said that the corona crisis is harming their mental health. About 54% of those who lost their job claim that it has affected their mental health, versus those who have not lost their job, 40% claim that it has affected to them. Indeed, it has affected both the regular citizens and the healthcare workers. In the US also, about 36% of Americans say that coronavirus has been serious impact in their mental health. How? In multiple stresses. The pandemic, the fear of the unknown. It also created social isolation, as well as it affected the income because of unemployment. In fact, here in Las Vegas, it is very sad. What used to be a 24/7 town that opens up to the world at 12 midnight, it's almost like a ghost town up until now. Looking at also the population here in the US, 4% of those 4% of affected by the pandemic are Asians. The problem here is that among Asian community, only 4% of the provider knows and speak various languages of the Asian population, and one of which is Filipino. So that's a very little percentage of the mental health care worker that would take care of the Asians that are affected by the virus in mental health perspective. So what are the changes in our daily routine, or how this pandemic affect our daily routine, and how does it affect our mental health? Well, it created new realities. The working from home. Sometimes we think that it's so easy, but if you think about it, that even kids are not going to school, they are staying at home. That little noise, the distraction while you're working at home is already a source of stress. It created unemployment. Some might be temporary, but some also drag until now. Homeschooling children are also another challenge, as I've mentioned before. Lack of physical contact with other family members. It created that isolation. It created separation that it actually increased the stress level. And then you have to know the unknown of how to deal with the virus, managing the fear as well as the fear of contracting the virus is very real. So you have the psychological impact of dealing with what is the unknown and the changes that it brought with us. So that's how it affected a unique population, the Asian, probably a reflection also there in the Philippines. But the general population has been stressed. So how does it affect the workers during this outbreak? Well, the strict biosecurity measure, checking temperature, wearing masks, wearing face shield, social distancing, those are our strict biosecurity measures that actually added a new routine on us. That's another way of increasing the stress and adaptation. I mentioned again before, the physical isolation is very true to all workers. It may not be only the healthcare workers, but also the office workers, the business sector, the industry. Nobody is spared about it. So we do practice physical isolation. The restriction on touching others, even after work hours, afford another stress level. The constant awareness and vigilance regarding infection control procedure that sometimes change a lot over time. Wearing of PPEs. We don't usually go out to social gathering wearing masks, but now we have to. So the supply of it also brings with it its own stress level. And then the pressure regarding procedure that must be followed, which as a result change our daily routine because it lacks spontaneity. It lacks the natural way of acting out a living. This does not only affect healthcare workers, it affects worker in general, and it affects the general population. So, as I've mentioned before, the stress in work during the outbreak increases the risk. It was due to risk of disease transmission, and to some sectors, it increased multiple work and personal demands. Not to mention the stigma of getting it, or the stigma even of contracting one. And especially in the Philippines, our culture usually stigmatize certain disease process, and one of which is this unknown COVID. Yet, not to mention the stigma that has been there culturally with our mental health issue. So how does it impact everyone? It created this picture, and it increases the incidences of depression, anxiety, and PTSD. Well, some minor diagnosis called PTSS, or post-traumatic stress syndrome, which also a reflection, or is a very close related to PTSD. These are the three common diagnoses or mental health diagnosis that has been hounding us due to this pandemic. So depression, as one of those, is a true illness. You know, it's always been my message. It is not about weakness of a person. It is not about the wrath of God. Depression is a real illness with physiological basis. It has physiological basis. It has physical basis, as because of the imbalance in chemical of the body. It is characterized by feeling of unhappiness, the loss of pleasure, the loss of excitement, which in fact it can affect relationship, it can affect work, it can even affect your daily living. It is also the feeling of helplessness, worthlessness, that may even lead to thoughts of suicide. That cases has increased due to the pandemic. Anxiety also is another mental health diagnosis that has been known to have surged during this pandemic in the past 7 months that we're dealing with COVID. Anxiety is described as a fear of the unknown. It is the body's natural response to stress, yet it created that fear of the unknown, the apprehension of what is the outcome in this time of pandemic. It might be helpful to note that there might be different level, but each level have increased during this pandemic. How do we react as a general population to this stress? Our mental health, some mental health theories provided us with the knowledge that individual, when faced with uncertainty, with some grieving or loss, goes into different cycle. First was the stage of disbelief. This could not be happening to us. That's when we wake up in March, or we hear it first in February, that there's something going on in China, in Yuan, and everyone says, you know what? It can't happen probably in the Philippines. This is not true. This is just with the news. And slowly trickling in, the reality sits in. So it's always, the human reaction of the disbelief would happen. Then perhaps as the reality starts to set in, anger continues. Anger will be another normal reaction to this unique situation. Then there could be probably feeling of sadness as the threat becomes real. Only through this that a person go through this mental health stages of grieving or fear that the person would go into a stage of what we call the acceptance, which could ultimately, if dealt with positively, may lead to optimism. And that's where sometimes what we like to achieve, we have to go through the different stages in order to be optimistic of what we can do. Perhaps buying time, over time of 7 months, there are some good result to it. As we go through the process, people are more optimistic now of what they can do as they learn more. Well, those are the cycle of the grieving process. But the question is, what are the common stress reaction during these critical incidences? So usually, strong emotional reaction can interfere with our ability to function, to perform, the duties effectively. And that's when we start experiencing the stress reaction. But it's also very important that as we deal with this pandemic, each one of us, not only healthcare worker, but worker in general and the general population, even our family, our friends, should be informed that this reaction can be normalized. What do we mean by normalize this reaction? That we have to also remind ourselves that these are normal reaction that normal people have or will experience during an abnormal event, such as a pandemic. That is also very important that we have to share these thoughts, because other people who notice changes in their day-to-day reaction might start thinking and questioning themselves. And if it was not normalized, they start believing that they're falling apart. But telling them about the normal reaction would actually, what we mean by it normalizes this reaction during this unique situation. So what are the different reaction that can be experienced by everyone, may it be healthcare worker, other industry worker, your family, your friend, or even you might go through as we go through the pandemic? Physical reaction is very real. Some people would experience some GI discomfort, crampings, breathing problems, sweating, feeling fatigue, headache, chills, increase in illness perception, rapid heartbeat, feeling nauseated, dizziness, or even chest pain can be very common physical change and reaction as we dealt with this unique situation, and sometimes brought about by increase in anxiety. Emotional reaction is also part of our reaction to this stressful event. There are periods when we deny the reality of what's going on. In fact, if we get diagnosed with COVID, another reaction is denial. Some people go into feeling being depressed and sad. The feeling of powerlessness is very common emotional reaction during this pandemic. Grief, fear, feeling of apprehension, sometimes irritability and anger is a very common reaction to individual. Feeling of helplessness, guilt, or even feeling being panicked and anxious. Or sometimes, if you didn't contract the virus, some people would feel guilty even for no reason at all. These are most common emotional reaction, and these can happen along with physical reaction that I mentioned earlier. But not only physically or emotionally that we have some reaction in dealing with this uncertain situation. It may also affect our cognition, the way we think, the way we anticipate things. It can affect our memory. There will be nightmares, disorientation, intrusive images of fearful in nature, sleep problem. Also, people who used to be very decisive might have difficulty in problem solving. There could be, to some people, there could be apathy, bluntness, or being dry. But some people also would react differently. They become more perfectionist, or they become very, very critical. These are some common cognitive reactions that individual may experience during this pandemic. Behavioral reaction is also very apparent. Altered speech, use of alcohol, withdrawn, blaming others, anger outburst, irritability. They can be startled easily. Or even people who start to manifest some symptom of depression may even have or resort to poor hygiene as the way they react to the reality of the pandemic. People can have mood swings and be moody also. And it can also even affect our spiritual being. Some people, there could be some spiritual reactions such as questioning faith, questioning their supernatural belief or figure of belief and faith, anger, and even disassociation. Feeling of not being in a real world can also be another high spiritual reaction among these individuals. But all of this are reaction we have as a normal person. But how can we overcome? It is a very important also that not everyone would go down that road. Everyone have their own strength. And that's when we come to the concept of resiliency. Resiliency is the psychological quality that allows a person to be knocked down by adversity such as this pandemic in life and come back at least stronger as before. It is important also to note that as we go through these changes, these challenges, this is a reaction, this normal reaction to the abnormal situation, that we have some power within us to note. We have psychological, values and capability to be resilient and learn insights out from this experience. It is how we hound our quality of being resilient. But what is really behind resiliency? How one develop this skill or grow on this skill so that we could use this as our tool as we navigate the changes that we're experiencing right now. Well, it's also very important to know that using and identifying our values that we learn over time, may it be from our family, our learning, academia, the values that we have inculcated can be used or is what is behind the value of resiliency. So what are these values that we could tap? Because if we identify these values as we introject ourselves, we start to build up that psychological value of resiliency. The coping skill we learn, how we deal with the problem. We could look at a glass half empty or half full. That goes also the value of optimism that we have. You have to be acknowledging and learning how to look at things in a positive way. The value of self-efficacy, believing yourself and what you can contribute to others. Very important, and it's very common among Filipinos, is the value of humor. That there are times, even in the most difficult and challenging moment, that we find ourselves to smile and throw jokes, Those are values that can also support and build up that feeling of being resilient. The sense of control we have, that there are things that we could make a difference by a sense of control. The competence, trust yourself, along with your self-efficacy, the value of competence, trusting what you can do and what you could contribute, and trusting your own skill in your own discipline. The value of instilling hope, along with the value of spirituality. I think that's one strength of the Filipino workers, not only healthcare workers, but also Filipino workers and Filipino citizenry, is our strength in our sense of spirituality and belief-based practices. All of these values, if you identify and practice or revisit, builds up that resiliency concept. So looking back, if we talk about how this pandemic affects healthcare worker, how this pandemic affects our community, how this pandemic affects our citizenry, is also very important that we have also to consider how this pandemic can affect our vulnerable population. And one of which of our vulnerable population are our cancer patients. That is very important too, because we might be very busy taking care of our own family, which in righteousness we should, but we also have to look at our profession. Most of us who are now attending this webinar are also healthcare workers. For some reason, we take care of our patient, but we have the elderly, we have the very young, but of special consideration also are our cancer patient. the mental health impact of this pandemic among our cancer patients if you're working in oncology. So I would like to refer to this discussion here when it comes to our cancer patient as it relates to an Asian study made in April, spearheaded by a Chinese university, and what's been done in April 2020. So I'm referencing it to this study that has been published. So the N, or the population that they look at, is for a population of about 6,000, close to 7,000 cancer patients, and they were evaluating how this pandemic affects the mental health. Again, as I've said, this is the closest that I could get in the Philippines, because for sure, as we navigate in the Philippines right now, I don't know how much research has been published, or could be research that's been done, but how much have been published already does it relate to the mental health. But we do have some data from our neighboring region, which is the Asian continent. So according to this study, mental health as it pertains to cancer patients during COVID crisis shows that there are about 23% of many cancer patients suffered mental health diagnosis, especially depression. Next to that, for 17.7% of these cancer patients experience heightened anxiety, while 13% of these patients experience symptoms related to hostility, anger, and indifference. And about also 9% experience symptoms significant of PTSD. So this pandemic certainly has affected our cancer, our vulnerable patient. And these are the 4 leading mental health issues identified to be increased during this pandemic time. So what are the risk factors? What are the risk factors that would affect mental health, or that may create mental health problem among our cancer patients during this COVID time? 1, it has been found out in this study that those patients who has history of mental disorder, who happens to have cancer, are more at risk to develop those mental health problems during this pandemic. Patient also, cancer patient who have shown or history of excessive use of substances, such as alcohol, are more prone to develop mental health problem during this pandemic. Worrying about cancer management during COVID-19 is a reality that can impact mental health status during this pandemic. Well, of course, if you are a cancer patient, I think, and during this pandemic, when it's so hard, there's lockdown, there's lockdown, you cannot just go from point A to point B, especially during, April, May, June time, when it was so strict and tight. I mean, those people who are actually in the middle of their cancer treatment probably have all the reason to worry about the management during this COVID. What if, and especially the question, not only the continuation of treatment, they become at risk also with pandemic. They become high risk to also contract the virus because of their cancer diagnosis. Another risk factor among cancer patients for mental health problem are those people who felt overwhelmed, the psychological pressure of COVID-19, how it is transmitted. It is known. What should I do? How will I get? What are the signs and symptoms? Each one have different signs and symptoms, or they discover new signs and symptoms along the way. Those would pose a psychological pressure during this COVID crisis. And last two is very common among our cancer patients. Those cancer patients that has high level of cancer fatigue can be related to their nature of their cancer, if not the treatment side effect. as well as those patients who will experience high level of cancer pain, has high risk to develop mental health problem during this pandemic. And it's also talking about the risk factor. It's also very important to know that only in this study, they identified that only 1.9% of these cancer patients seeks mental health support. I mean, sad enough that they're dealing with their own cancer treatment and their concept of cancer survival and being healthy and strong. Then if they develop mental health problem, it's another reason for them to seek another specialty. But to note that in this study, they identify that all of these people who have this risk factor and may also be experiencing mental health problem, only 1.9% of them seek help. I don't know the data in the Philippines, but with a culture of mental health stigma or the social stigma of mental health and psychiatry, who's scourging high, what about seeking help when you have cancer? That could also be a challenge. So what's the prevalence of mental health problem among cancer patients? As I've said, about 15.8% of cancer patients will has symptoms of mental disorder. So the prevalence of mental health problem in cancer patients during the pandemic is your depression, anxiety. It even identify some psychotic symptoms and stress-related disorder. Half of the cancer patients are also affected with mental health disorder. So that's also very important. Of course, the new life adjustment of cancer treatment, the multiple doctors visit, and not to mention the various signs and symptoms that they may experiencing would actually cause a lot of risk factor in the development of mental health disorder. So what's the effect of mental health disorder among cancer patients? How does it affect, mental health disorder among cancer patients during this pandemic? In this study, they identify that mental health disorder among cancer patients may decrease treatment adherence. Not to mention some probably motivation, fighting spirit with a depressed person is very low. They feel tired. They feel less energetic. So decrease in treatment adherence is a challenge posed by cancer patient when it comes to mental health disorder or how this mental health disorder can affect cancer patient. Decrease in survival rate. Again, the feeling of being depressed, the feeling of being anxious and and also fearful during while they're dealing with their cancer treatment can decrease survival rate. Or the more the person has an untreated mental health disorder while they're dealing with their cancer, can also decrease survival rate. Mental health disorder among cancer patients also can increase healthcare costs, not to mention medications, multiple visits. And in fact, it can also affect cancer treatment themselves. And big in mental health is impact of quality of life. Can you just imagine while you're dealing with tired or fatigue and pain, you can also be dealing with decreased motivation, decreased ability to relate with others because of withdrawal and seclusion. That alone can impact quality of life. The study also identified that cancer patient with severe mental health problem are more likely to be hospitalized, so that increased the cost, and even identified that cancer patient with severe mental health problem may have a death, or may die in 12 months post-diagnosis. That is very concerning. Think about it during the pandemic time, when there's an added stress on top of their present situation. In general, even in general population and general psychiatric problem during this COVID, people experience anxiety, depression, stress, PTSD, insomnia, anger, impulsivity, suicide ideation, and even poor follow-up of care. So these are even in general psychiatric problem or population that this COVID may intensify, which also supports those symptoms that we identified already as a stress reaction to COVID. And so therefore, if we compare this to general psychiatric problem during COVID, cancer patient may have an exaggerated mental health problem in this case. But we have been talking about how it affects our vulnerable population. We haven't talked that there could be some protective factors to minimize mental health problem. So that's good to know. So if we identify factors on how we are affected, it's also good to identify what are some of our protective factors to minimize mental health problem among or during COVID among our cancer patients, so that as healthcare workers, we may build this one up. As I've said, we start talking about how we ourselves react to COVID. Now we're looking at how we, although as healthcare worker affected by COVID, can also still support our vulnerable population, such as the cancer patient. So it's good to know what are these protective factors so that we could build upon this in order to take care of the needs of our vulnerable population. One, what are these protective factors? People who felt that they have better quality of life tends to have minimal mental health issues to develop. But sometimes it's very subjective, especially in our locality or in our country where there are a lot of poverty. But quality of life is their own perception of how satisfied they are with their life, living, income, and relationship. In fact, another protective factor to minimize mental health among cancer patients during this COVID time are the perception of what is a good relationship with family members. Having a good value and a good relationship among family members has found to be impactful in minimizing mental health problems. Younger age, has been identified. The younger cancer population is in itself a protective factor to minimize mental health problem. For some reason, the study identified also male sex. I tried to look at what is behind it. I did not get a straight answer to the literature that I reviewed, but they identified that male is itself a protective factor in minimizing mental health among cancer patients during this COVID time. Could it be probably the cultural self and madness, self-efficacy concept of being a male, that you need to be strong and have a fighting spirit to stand for the positiveness, or that one is expected? Or could it be the sense of control? But these things, or it could be cultural, the sense of control, role expectation, could have contributed to being a male and its impact as a protective factor to minimize mental health. Patients who have cancer who are longer time since their diagnosis has also been found out to be a factor to minimize the impact of mental health among cancer patients. So the longer they know, they probably was able to adjust now to their diagnosis. They probably a survivor themselves. So it actually strengthened the sense of resiliency. Uh, Frequency of receiving COVID information. Now, I'm talking here. Not about the fear that you hear in the news, but what you hear that is positive in the news. The more will inform the patient about what's going on in the COVID, the information that probably the repeat over and over in some news agency. But what I'm saying is the more information a patient would know about the trend, the care, as well as the treatment of cancer, the more they are encouraged. So it becomes a protective factor. Satisfaction of personal health is another protective factor against mental health problem during this pandemic. And also good sleep habits. Good sleep habits can contribute in minimizing mental health problem among our cancer patients during this COVID time. And lastly, good relationship with friends who will form as our support. And I have to tie it up to that second factor there that says good relation with family member and a good relationship with friends as a support are protective factors against mental health or increasing mental health in severity among cancer patients. I would like also to bring your attention that there are those identified asterisks being employed is a factor. Longer time since diagnosis is an asterisk, and good sleep habit. These are factors that the study identify as contributing factor to depression. So if you have good sleep habits, longer time since diagnosis, and you have an employment, it seems to minimize the incidences of depression. The rest of the factors are significant in anxiety. So, what's the impact of COVID-19 to mental health care services and management? We talked about the impact of COVID-19 to mental health status. Now we would like to look at how this pandemic time can affect mental health care and services of our cancer management. One, this time can impact to prevent the preventable decline of cancer condition. It prevents the preventable decline in cancer condition. So that's how it impacts. COVID-19 seems to slow down what seems to be preventable decline of cancer. So in a nutshell, this may impact in cancer management because there could be more enhanced advancement of the condition in a cancer patient. Prevent possible hospitalization. It prevents possible hospitalization because the travel, the security, or the lockdown may impact cancer management. It can also impact healthcare overload. It prevents healthcare overload. If mental health care worker takes care of our cancer patient in their mental health, it may lead to a decreased overload of our healthcare worker who's already overloaded by COVID-19 cases. So it's very important that we have to consider to deal and treat our cancer patients with mental health so that they don't find themselves in the hospital. And then generally also it has an impact in the quality of life of the individual. So what are some mental health recommendations that we could apply to our cancer patient who are high-risk group during this pandemic? So knowing that incidences of mental health problem increase during this pandemic to our vulnerable population among our cancer patient, it is also suggested in this study that screening for mental health morbidities should be done. Part of the cancer management training as a recommendation is to screen them, is to screen their mental health status. Early intervention, and it can even be done during this pandemic when we have social isolation via virtual platforms. I mean, I use Zoom. I see patient as a nurse practitioner. Here, I have my own clinic. In the state of Nevada, we are one of the 8 states throughout the country in the US that has independent practice for your population focus. And I focus on mental health. So I have my own clinic without doctors' collaboration. And I have made that stride where there's 8 other states. When I was the president of the Nevada State Board of Nursing. So, but I can only treat and manage my population focus, which is mental health. So I use virtual platform. I see patient 100% via Zoom. And then I screen them all the first time I've seen them. Adaptation of psycho-oncological care for cancer patient. And it is very important, and I think it's been already a norm that we have to incorporate mental health care among our cancer patient, even on day 1 of their diagnosis. So it's very important that that oncologists, psychiatrists, and nurses should collaborate and learn about psycho-oncological care among our cancer patient. Screening cancer patient for anxiety and depression is a good way. And in fact, nurses can be trained to screen them so that proper referral to the primary care oncologist and to psychiatrists can be done. Provide mental health assessment and referral after cancer diagnosis, which I have mentioned. And during COVID, oncology clinic may provide an online continued screening due to social distancing protocol. So I also include what are the most common screening tool that we could use as we deal with our cancer patients so that we could identify in proper screening as they go to the pandemic time. Sorry. A lockout here. So one of which is the use of PHQ-9. One of which is the use of a PHQ-9 screening tool for depression. And as I also use, for anxiety, I use the GAD-7 anxiety screening tool. And this could be some example that can be adapted in an oncology practice so that we could make sure that we incorporate mental health as we take care of our own cancer patient in this time. We mentioned before that one factor of preventing one factor or preventative factor to minimize mental health impact is the relationship in the family. So I came up with also, as I adapted the study, what are some of the family relationship that we could enhance or how we could enhance family relationship during this pandemic. We could do online, we could encourage family to have an online conversation regularly with our cancer patient or vulnerable population. Give update to each other positively. So that's when we come up with news update focusing on how pandemic is being controlled, offer strategies of self-protection, and provide contact information of significant people or support. These are all update information that can be shared with our vulnerable patients or cancer patient so that it enhances that relationship in the family. Spending quality time away from the crowded spaces, but only with immediate family members. The concept of going a nature trip, parks, the beach, along with your family or close family can increase that family ties that would enhance or if not minimize mental health problem impact, and even outdoor activities, which is it decreases the risk of spreading the virus, and also enhance lifestyle and hobbies that you probably would not haven't identified before, because probably with the lockdown you stay with your family. So now what happened now? A lot of people discover that they have talent in planting. They have talent in baking, in cooking. Even here in Las Vegas, it's so funny. I think among the Filipino population, the purple pandesal or the OB pandesal becomes very, very prominent and famous during the pandemic time. Discovering those lifestyle and hobbies could enhance that family relationship. So in a nutshell, looking at ourselves as healthcare workers and as we understand our cancer patient, how do we take care of ourselves so that we could take care more effectively also our cancer or vulnerable population? Start to practice mental health resiliency, like yourself. Find time to adapt to change. Dare to say no, not all the time that you have to say yes to because that could increase your anxiety. Be a go-getter. Set up a goal that's realistic and go for it. Talk about your fears. Talk about your goals. Talk about your weaknesses and also your strength. Try something new, as I've said before. You don't know you're a good healthcare worker, but you could be a good chef or a good hobbyist in planting, building up your succulent plants. So try something new and discover yourself. Take the bad with the good. Take it as a package. Relax and let go. Nature versus nurture. Apply it to yourself, because it's only when you are self-resilient that you can be more effective in taking care of your vulnerable patients. Set your own goal. Get fit physically. Maintain physical fitness. Maybe you don't need to be buff, but have a regular fitness routine. Know to learn when to ask. And of course, count on friends and family for support. So, what are some other do's that you could perform or you could practice as a care worker dealing with high vulnerable patient during this time and pandemic? Always self-monitor and pace yourself. What are the time you spend at work? Don't do too much overtime. I think that's one of the problem among Filipino nurses here in the US. That's why even though we are comprised with 4%, 31.4% of casualty or mortality are Filipinos. Probably why? Because Filipinos love to work overtime a lot and they work graveyard shift, not to mention the diet. So self-monitor yourself. We always like greasy foods that can impact our cardiovascular. So self-monitor and pace yourself. Regular check-in with other colleagues and family members. Work in partners or in teams. Don't work by yourself or seek help. Believe in your relaxation and stress management is very important. So take your break. Take appropriate break. Regular peer consultation and supervision. Call for timeout for bodily care, and refreshments. Avoid focusing on fear. Minimize listening to fearful or news. Focus on effort within what you can do for your power. Acceptance of situation that you cannot change, and then foster a spirit of fortitude. So during the pandemic, in a nutshell, we need to maintain structure in our life, create a routine, find ways to be accountable to others, invest energy on the most intimate relationship. Do not forget to build that relationship, your intimate relationship with your spouse, with your significant others. Reach out and continue to nurture our social connection. even virtually. Take this opportunity to strengthen different parts of your identity. Do something new and discover something new about yourself. Take control of whatever you can control to combat the feeling of helplessness. Nurture a sense of belonging and also build on your spiritual path and belief. Exercise your rights. Assert for yourself, even in your employment community or in your employment, in your offices. Look after your own basic needs. When possible, stabilize your finances. Consider that. Think positive thoughts and do everything you can to stay hopeful. Always grateful about what you can do to yourself so that you could give more to others, including our vulnerable patient, our dear cancer patient. Thank you so much. And I'll end up this presentation with that thoughts, and I will open up for any questions or discussions. Thank you.
Thank you, Dr. Tan, for that wonderful lecture. We have learned a lot today from your talk. The COVID-19 pandemic has alarming implications for everyone, and specifically for the vulnerable populations like patients with cancer and even the people taking care of them, and that's us, the healthcare workers, the team working on the front line. I have a question here from Idana Alanton. You remember Idana? Nanan? Yes, all the way from Ireland. Hi, Nan. Thank you for the
Hello.
question. No, let me just take a retrieve your question, Nan. Where's that? Sorry. Okay. Nana's question says that how do we support each other? How do we encourage each other? And how do we tell each other that we are doing a good job when in fact we can feel the fear inside us? In this current pandemic, all health caregivers are doing a fantastic job in alleviating the fears of their patients and their families. Healthcare providers think of their patients first before of themselves. So how do we take care of ourselves too?
Yeah, that's a very realistic question. Hi, Dan. Hi, Nan. It's been a long time I haven't seen you. Anyway, that's a very, very realistic question. You know, care for the caregiver is always the principle. We give a lot as a care provider, maybe in the medical field, in the nursing field, in allied health sciences, or any other allied profession in health. We are all have that nurturing personality of giving to others, but we have to stop and look and acknowledge each other's job. We contribute to the biggest whole of the pie. It would never be a whole pie if we never have a chance to contribute our expertise, and we have to stop and look and give each others that support. And in doing so, we also have to remind ourselves that there has to be a time where we have to give a care to their caregivers. And that's one thing too. And caring doesn't only mean that you're always be the go with the flow, always giving during demands. Caring to oneself also is to assert saying no. Set limits to yourself. You got to self-limit. Remember, if you don't take care of yourself and set limits to yourself, and you stretch too much, too long, it affects your mental health. And when it does, you forfeit giving care to our beloved patients. So always under that, self-care means caring for our own patient.
I agree with you, Rigel. Dr. Tan, I agree with you on that point, and absolutely. Because I believe in caregiver fatigue and burnout. It happens when you undergo a lot of stress, extreme stress. So this lecture is really a big help to all of us. Idana said her questions are based on their experience, of course ours too. Sometimes they find it hard to encourage their staff to keep going because, the pandemic is affecting everyone. And she has another question, if you don't mind.
No, yeah, go ahead.
She had She had a cancer patient who passed away recently. And when the patient was dying, only her husband was allowed to come in the room because of the pandemic. Her children were outside the window watching their mom pass away. This is really very real. Their grandchildren by the window watching this situation is very painful. How will this impact their mental health in the future for the kids?
Well, I mean, everyone grieved differently. You know, we have our own unique subjective way of grieving. May it be our own experience, may it be coming from our background, or even cultural. However, in this time of pandemic, it makes it more unique because we are dealing with two fears. The fears of having the virus for everyone, and then the fear of losing somebody we love and seeing them painfully. And it's very real, because we have that fear of the pandemic, only very certain people are allowed to be with that somebody who's undergoing death and dying because probably of what reason, and one of which is cancer. So it has an emotional impact to everyone. And everyone probably is discovering new ways of how they grieve. And I think what is more mentally healthy after the situation, when there's some settling down, we should allow all these family members to grieve in their own. And probably a debriefing within the family, the talk, the support. And culturally, I don't know what's the background of this family that was described. We got to make sure also that we consider their cultural practices, their cultural norm in dealing with their debriefing and grieving process. Yes, it can have an impact. It can be very traumatizing. And during our presentation, I even identify that PTSS, post-traumatic stress syndrome, if not post-traumatic stress disorder, is very common experience among not only the patient, but the family and the general community. So I always an advocate for talk and reach out. Talking, support, and reaching out is actually would decrease that grieving process and the impact of the uniqueness of the situation.
Thank you for that, Dr. Tan. I think everybody, almost everyone, lost a loved one. We all did here in Cebu. Until now, if I remember what when we lost our director, I still get teary-eyed. So I think all of us needs a psychological first aid if there is one. Do you
There
agree?
is,
How,
yeah,
how do you how do
definitely.
you do that? How do you do that? Psychological first aid.
Psychological first aid, yes. I mean, although, in layman's term, if we have simplified, psychological first aid is allowing yourself to express. Do not hold it. Each one is discovering their own way of emotion and expression. But the best way of healing emotionally and behaviorally is expressing it to others. Remember, emotion is an energy. The more you keep it, the more you question, and the more you question, the more it inflates within you. And then there comes a time that your reaction is unknown to you, and it just surprise you. Why are you reacting it that way? Because as an energy, it builds up and it has a way to exhaust itself. So do not wait until that point would arrive. Express yourself. Find somebody to talk to. If it's not somebody that's close, your BFF, your family, it could be your counselor, it could be your spiritual guide. No, somebody, reach out for that somebody, and then you're doing yourself a favor in doing so.
Okay, I have one last question from Dr. Jade Lotus Pinera. She's a medical oncologist based in Manila. Hello,
Hi, Doc.
Dr. Jade. Thank you for your question. Do you have suggestions how hospital administrations or nursing services unit can help their staff psychologically and prevent burnouts? That's exactly the same question in my mind too. Thank you for that,
Yeah,
Dr.
and that's
Jade.
very, very true. And that's very, very true. And this is one of my advocacy. And the reason, in fact, if you listen to a little presentation that I have when I was saying that I was advocating for mental health, it starts with Cebu. When
Yeah.
we have the city ordinance and it becomes the Mental Health Act of the Philippines,
Mhm.
one of my goal there, one of my goal is the employment-based EAP. And we don't have that in the
We don't have
Philippines.
that here.
Yeah, and the employment-based EAP means Employee Assistant Program. I mean, even in BPOs, and not only BPOs, that's outside the hospital, so much more when we're taking care of the sick and the dying, we need that support. I remember myself when I was a new nurse here in Las Vegas, I have to adapt with the culture. I have to adapt with the learning curve. And situate, and the anxiety goes up so much more in this time of pandemic. But an EAQ is very helpful. What it is you just have to pick up the phone, and each employee will be in a special number, was directed to a therapist, a psychologist that they could talk to while they are at work. And every year we have that benefit that we could reach out to a therapist for free, and it's a mandatory in many of the hospital and any employment base here, that you could start talking, and then it involves even your spouse, that you could talk about it, and then for 10 times in a year if you need so, and then it would renew. So that's one thing. It's emotional behavioral support to many of our, and it becomes a program. I was hoping, when I was helping advocate for that legislation, for that regulation, that would be a part of the outcome. And then, of course, camaraderie within each other, give each other a pat of the back, going out, going out together as a team building activity is also, it's not only for business sector, it is also very true among us in the medical field.
Thank you for that. Dr. Tan, I think in the interest of time, I think we need to wrap this up. We
I
are
can stay if there's any question. But,
yes,
yeah,
yes.
but
If there
I
are
know
more
where it is.
questions,
Yeah.
maybe we can email you
Yes,
some of
yes.
their questions
Dr.
later.
Sanchez, yeah.
Yes, Jamela, you can just call me Jamela.
Yeah.
We need people like you in Cebu. Hopefully someday when the world heals, you can come home for a
I know,
while
that's
and help
always my
us.
goal. That's always, my heart is always in Cebu.
Help us, Rigel. We need you. And thank you so much for saying yes to my kakulitan and everything. I know
Oh,
you're
it's good.
very busy. I'm just very proud of you.
Thank you so much,
Yeah.
Doctor.
Salamat gid kaayo. Amping diha.
And of course, Waldemar, and also Waldemar's brother was my classmate in CNU and CSC.
Oh, okay.
Yeah,
Okay, I'll tell him
so
you
how
said
could I say no to you?
thank you. I'm eternally grateful. Hope to see you again in one of our global reunions someday.
Yep, someday
Someday
we will
soon.
do it again. And thank you for
Yes.
visiting us here in Las Vegas in 2017.
It was my pleasure. I had a grand time there. Thank you. With that, I would like to thank everyone for attending this webinar. It's been a great pleasure to listen to you. We learned a lot. And I hope this is not the last. This is just the first of the many webinars that we're going to come up with in the very near futures. Thank you for supporting
Thank you.
us. Have a good day. Amping Mutanan.
Thank you very much, Jamela, for moderating this session with Rigel. And Dr. Rigel Tan, we cannot thank you enough for the wondrous things that you do in your life, and including Cebu and the whole Philippines as well. So the whole Filipinos, thank you. And I know it's 1 a.m. in Las Vegas, so we won't keep you any longer. And I wish to thank everyone who supported us from September 26th, from the first webinar up to now. So we've had a grand 4 webinars from the Cebu Cancer Institute. And with that, in behalf of the CEO, Mother Zeta Caridad Rivero, and the Medical Director, Dr. Poreza Onyate, I would like to thank everyone for really abiding with us for these past 4 Saturdays, and all the moderators and our team comprised of, again, Dr. Jamela Sanchez, Dr. Arnold Uson, and the fantastic residents of internal medicine at the Perpetual Succor Hospital. So Godspeed, everyone. Keep safe. God bless.
We would like to thank the following sponsors: OEP Philippines Incorporated for our platinum sponsors. Mundi Pharma, BioOnco Incorporated, an oncology subsidiary of Unilab. Sandoz and Novartis Division. And Goodfellow Pharma. For our gold sponsors, we'd like to thank Mylan, Better Health for Better World, and Calbe International. For our silver sponsors, we'd like to thank Camber Pharmaceutical, a subsidiary of Hetero, and Novartis Oncology. For our bronze sponsors, we'd like to thank the Toxicare Philippines Incorporated. Our special thanks to Roche Philippines.